Yes, I'm ready.
And she doesn't know her station yet, right? I'm
Yeah.
gonna choose her station.
No.
No, I know
I told her about the
pulmonary
station.
aneurysm.
Okay, fine. What station is she doing?
Infective pseudoaneurysm.
All right. Let me just put the timer. Yeah, you can start now.
Hello, I'm Dr. Amani, one of the surgical doctor. Can you confirm your name and age, please?
Hello, doctor. My name is John. I am 45 years old.
Nice to meet you, Mr. John. Today I have been asked to ask you some questions regarding your condition. Are you okay with this?
Yeah, that's fine, doctor.
Okay, thank you. Could you please tell me what brought you here today?
Oh, doctor, you ask about something really bothering me. I have this lump in my left thigh.
Uh, Actually, I'm really sorry to hear that. It sounds to be difficult for you. I want to ask you some questions regarding this lump, okay?
Okay, doctor, go ahead.
Yeah, you say in your right side, right?
No, left thigh. In my left side.
Oh, okay, sorry. When it has first started,
5 days ago.
it starts suddenly or gradually?
I'm not sure, doctor, but it's getting worse day by day.
Uh-huh. It is here there all the time or come and go?
It's here all the time.
Uh-huh. Anything increase her size or decrease it?
Just time. It's getting bigger by the time, doctor.
Uh-huh. It is has been?
Could you please repeat your question?
It has been, you have been in the site of this
Yeah, doctor, I
lump?
have this pain, yes.
Really sorry for that. Did you notice any lump in any other side in your body?
No, this just this lump in my left thigh.
This first time to have something like this?
I'm not sure about this, doctor, but I did the first time I noticed this lump.
Okay. Do you have any history of injection or trauma to this side before, recently?
Yeah, doctor, that's right. I am always injecting my left thigh. Is that related to this, doctor?
Yeah, it is related. You inject alone or injected you this is medication by a doctor or you just inject
No,
yourself?
just me and with my friend.
Okay, I get it. Yeah. It's related to your condition, but let me complete our history, try to find out what's going on. Okay, Mr.
Okay,
John?
okay, doctor.
Do you feel it has pulses?
Yeah, that's right, doctor.
You any fever?
Fever. Sometimes I feel fever in the side of the lump, doctor.
Like it is hot, there is hotness inside of the
Yes,
lump, right?
yes.
Any kink in skin over it, like become redness?
Uh, yeah, it's being red.
Okay, okay. Uh, do you notice any weakness or numbness in your leg?
No, I didn't experience any of that.
Any coldness or any pain on your leg?
No, doctor.
Any decrease on your appetite?
No, doctor. Why this couple of questions, doctors?
Yeah, because as I told you, there is different. We have differential diagnosis. We need to ask all possible questions, try to figure out your condition.
Go ahead.
Yeah, thank you. And do you notice that it is decreasing size when you are lie down?
No,
When you are doing something strange like passing urination or stool or coughing, it is increasing size?
no, 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 no.
Mhm. Okay. Do you have any history of hospital admissions before?
History of hospital admission. I think,
Yeah, like, uh-huh,
no, 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 no.
uh-huh. You have any chronic illness like diabetes, hypertension?
No, I have not any diabetes or hypertension, but doctor, I am allergic to penicillin.
Uh-huh. Okay. Okay. Uh-huh. You did any operation in the past?
No,
You use any medications in a regular pace?
no, doctor. Just I sometimes take paracetamol for this pain in my left thigh.
Uh-huh. Okay. Did you have any family history of similar condition?
No one I am aware of, doctor.
Uh, sorry for this question, but it's important for our history, Mr. John.
Mm-hmm.
Are you drinking alcohol?
No, doctor.
Smoking cigarette?
Smoking cigarettes. Sometimes I smoke cigarette, doctor.
Using any recreational medication, drugs?
Yes, as I told you previously, I inject myself
Mhm.
every day in my left thigh with my friends.
Okay. I want to ask you some personal question. What are you doing for a living, Mr. John?
I am unemployed, doctor.
Okay. Who live
Time,
at home with you?
time finished. 6 minutes. Okay, doctor. I'm gonna put the timer for 3 minutes now. And uh, can you present your patient, please?
Okay. Uh, this is Mr. John, 45-year-old. He has left side swelling since 5 days, increase in size with time, associated with pain. He has a history of injections several times to the same side, and it has pulses, and there is hotness and redness in the site of the swelling. He's allergic to penicillin and sometimes smoke, and he's using recreational drugs, and he is unemployed. According to history, my first differential diagnosis, it could be this is infected femoral pseudoaneurysm.
Okay. And what's your differential?
Also, I will consider it is inguinal abscess or inflammatory lymphadenopathy or neoplastic lymphadenopathy or inguinal hernia or neurologic, yes.
Do you have any other differential? Do you have any other differential?
Yeah, it could be cyst
Okay.
or lipoma.
How will you approach the investigation for this man?
Okay, after a full history and full examination, I will arrange blood tests like CBC and inflammatory marker, ESR, CRB, and CBC, LFT, RFT. Also, we'll use swab for cultures and sensitivities. We can run image like duplex ultrasonography, also CT angiography.
Okay. And how will you treat your patient?
Okay, I will treat this patient. First of all, I will. This patient need to be referred to. According to his condition, he need to be referred to psychiatrist also for treatment of his addiction. For his pseudofemoral aneurysm, I will be by ligation and ligation of the artery with delayed revascularization and ultrasound decompression, sometimes subcutaneous thrombin. And after the result of swab culture and sensitivity, may need to give this patient antibiotics.
All right. Do you have operative treatment for this man?
Uh,
Yeah, she mentioned it like
yes, Arterial ligation with
Yeah.
delayed revascularization.
Okay. Can you define a true aneurysm?
True aneurysm is localized dilatation of the three layer of the artery.
How much is the dilatation? Is 1 centimeter enough for for aorta to be aneurystic?
Actually, I'm not sure about the answer.
Fine. Okay. And time is finished, but I will ask you to define the pseudoaneurysm.
Pseudoaneurysm is dilatation of subintimal layer of the artery.
Okay. Fine. And the session is finished. All right. What do you think about your performance, Amani?
I think time problem, time management. Yeah.
Okay. What else? So firstly, let me say the good things. You differentiated all. You mentioned all the differential diagnoses, all of them, which is very good. You excluded the most important part, like growing abscess, hernia, and you asked about this question, but you didn't have any time to visit. You touched on the social history, but you didn't finish a past medical history, drug history, eyes, systemic review, and you didn't thank your patient at the end because the time didn't allow you. Okay. You mentioned multiple very small grammatical mistakes. People, this exam is about performance. It's not about the knowledge in your head. That's why I focus on the grammatical mistake and how you present yourself more, because it's an impression exam, more of a knowledge of exam. Do you write while you're taking the history?
Yes.
Did you write on paper? So you have first, I know most of the course administrator or those who giving a course, they say, yeah, you can write. But if you have time to get out of this habit, do it now. You should memorize the knowledge in your head and you should train yourself to memorize it. It's unprofessional for you to write like this while you're taking a history from the patient, and it does consume a lot of time. So you have to train yourself from now till your date of exam to abandon the paper, no writing. Okay, that's the first thing. I knew you writing, even though I don't see you, because you take time to write some important information and you get back. So I knew you writing. So get rid of this one. At the start, you said I have been asked to ask you. The best way to start, hello, my name is Amani. I'm one of the surgical doctors working here, and I will be your doctor for today. Are you okay with that? Yes. Okay, Mr. John, what brought you to the hospital today? Not I have been asked to ask you. Nobody said that in real life. My name is Ali. I'm one of the surgical doctors working here. Can I confirm your name and date of birth? Mr. John, I will be your doctor for today. Are you okay with that? It doesn't matter if you introduce yourself first or you took a permission first. That's not important. But how you say it is very important. Does it come and go instead of did it come and go? You said increase her size. Ha is wrong. You should say, does the lump increase in size? You don't mention ha. Lump is it. It's not ha, right? So that was incorrect. Your examiner, if he's fluent in English, will notice this mistake, and probably he will take some of your mark. Is it painful? And I notice also when you ask a question, you say it is painful. No, is it painful? You replace it. Is it painful? You start with is. Are you? Not you are in pain. Are you in pain? Do you say do you have pulsatile or something like that? Just ask a simple question. Is your lump pulsatile or no? If there any pulse, that's the other way to say it. He said, I'm allergic to penicillin, which you didn't present on your presentation because this patient, you should mention it while you're presenting your patient. When I said present your patient, you should say on your presentation after what he presented with, that the patient is allergic to penicillin. you asked 3 times about the operation in the past, and you asked multiple questions about the injection. Do you inject by yourself? Does anyone inject you? Is it by doctor? You don't need to waste a lot of time. He said he injecting himself, that he injecting himself. Everybody knows when he inject himself, no doctor will inject someone with drugs. So you don't need to get into deep of that question. When you came to the social history, you say, sorry for this question. You should say, I'm going to ask you a personal question. Are you okay with that? That's it. And then you move immediately to the social history. You said on your presentation, your patient is using nutritional drug. I think you meant recreational drug. It's not nutritional drug, it's recreational drug. On your treatment, you shouldn't start by psychiatrist, and I don't think psychiatrist is required. There is a drug abuse management, but psychiatrist is not part of it. You shouldn't start with it anyway. If you want to mention it, you should leave it to the last after you finish all your questions. You start with the pseudoaneurysm, and Ahmed Manufali, if you can just mute yourself here. You start with the important stuff. Injecting thrombin, I think we need to add this, Muhammad. That's very important, injecting thrombin, and that's what we're doing in our life. We start with compression, and then injecting thrombin, and if this didn't work, we go to the ligation. Your definition of the pseudoaneurysm and aneurysm need to be revised. So the true aneurysm is abnormal dilatation 1.5 times the original diameter. And think about if you have an artery which is 1 centimeter in diameter, for it to be aneurystic, it has to be 1.5, which means 1.5 centimeter. But if you have an aorta which is around 2 to 3 centimeter, if it's became 3.2 or 3.4, we don't call it aneurystic unless it became 1.5, the original size. So if it was 2, it has to be 3. And if it's 3, it has to be 4.5. And the diameter of the aorta differ from person to person. So you say abnormal dilatation 1.5 times the original diameter, involving the 3 layers, which are tunica media, tunica adventitia, and tunica intima. That's the 3 layers. And the pseudoaneurysm, collection of blood between the tunica media and tunica adventitia. So the intima is not involved. When the 3 layers are not involved, that's pseudoaneurysm. When the 3 layers are involved, that's true aneurysm. You have to review the definitions of the true and pseudoaneurysm. That's most of my point, Muhammad.
Okay, nice. Amani, you did very good. I just gonna through fast about your stations, which is infected pseudoaneurysm. You introduce yourself and take permission, but this scenario about the infective pseudoaneurysm, and there are 3 signs that indicate this station, which is the pain. You ask about the pulseness, but pain, you didn't analyze the pain. So I think you need to ask about 2 to 3 questions about the pain, because pain need analyze as Socrates. Then you miss the neoplastic lymph node neoplastic. Did you ask me about the appetite or weight loss?
Yes, I asked you and you told me why you asked me this couple of questions.
Nice. The last point regarding the management. So when you divide your management, you will get the mark of the professionalism. When I ask you how to treat this patient, you should answer we have operative and non-operative. Non-operative lab, operative lab. Same thing as the investigation. We have hematology, we have blood investigation, and we have imaging. You will get the mark of professionalism. It's about 4 marks. Okay, and in the treatment, let us confirm this. In any treatment of the station, say I will discuss the patient history and examination and investigation in a multidisciplinary team. Okay, and when Ali ask you how to approach this patient, start by I will do full clinical examination. Okay. Otherwise, you did very good, Amani.
Okay, is that clear, Amani?
Yeah, Ali.
Yes.
Yes. Thank you, doctor.
Okay, I just wanted to put principle before we go to the next station. I need
Yeah.
everyone in the next station to do it, okay?
Yes. Quickly.
After introduce yourself and take permission and starting asking the patient about the main complaint, feel sorry about his complaint, and then start to analyze the main complaint by an open question. I think she didn't do that. And apply Socrate template for any station. Pain, dysphagia, rectal bleeding, anything, apply Socrate, it will help you. And don't repeat the question already answered. Patient already answered question. If you told the patient, could you please tell me more about this, and start to say this started 2 days ago and it is dull in nature, don't repeat the question. Don't ask the patient what is the character of the pain. So you need to be focused and listen to the patient carefully. And by keeping practicing, you will master all these points.
Okay, we can move to the next. Raise your hand or say, I want to participate for the next one. And we're going to choose someone to participate in the next station. If it's your first time, that doesn't matter. Just raise your hand and say, I want to participate on this one. I can see Abadi is here. Who want to participate for the next one? Just write in the comment.
You need to practice to master the history station, even if it is the first time. You will not master history and communication skills, even you try to practice every day.
Without practice, quite difficult. It's like driving or knowing how to ride a cycle. You have to do it multiple times to get the nature of it. If nobody is raise his hand, we can go with Amani while someone prepare himself again. So Amani, you want to take a second station?
Okay.
Yes. Someone raise his hand. Who is this one?
Who raised?
Can I?
Hello?
Who?
Hello?
Hello? Can I participate?
Yes, you can participate. What's your name?
Abdul Muttalib.
Abdul Muttalib. Okay. Your station will be rectal bleeding, which is a very common station. Muhammad, we have just 10 minutes, and then we can create another meeting in the group again. You can start.
Ali, please put the timer for 6 minutes. And
Yes,
Abdul Muttalib, you know the scenario.
Okay, yes.
Yeah, it's an elderly man who is bleeding by rectum. Okay?
Okay.
I will be your patient. Okay, let's start.
Okay, hello.
Hello.
My name is Dr. Abdul Muttalib, one of surgical doctor. Could you confirm your name and age, please?
Hi, doctor. My name is John. I'm 73-year-old.
Okay, nice to meet you, Mr. John. How can I help you today?
Doctor, I came to the hospital because I went to the toilet and I noticed some blood coming out of the back passage.
Okay, I'm so sorry for that, Mr. John. Could you tell me more about this problem that happened to you?
To be honest, it did happen before, but then it stopped and I neglected it. And recently, it's became like daily. Every single day I go, I will find some blood on the back passage, on the wipes.
Okay. Could you please tell me when start exactly?
I couldn't say, but let's say I noticed it in the last 6 months.
Last 6 months. Okay. Is it present all the time that you
No,
go to the
day off,
loo?
day off and day on is like very, very ungradual and intermittent.
Okay. Could you tell me about the amount of the blood that you notice when you are going to the loo?
Yeah, it does vary, but I will say maybe 20 mils every time. I would estimate it around this.
Okay. What's the color of this blood?
It's dark red, doctor.
Dark. Okay.
Yeah,
Okay.
but sometimes there will
Is
be
it,
some lighter red, so it has two.
okay. Is it there's clots and you not sit with
No,
it?
no, no, no clots, no.
Okay. Okay. Is there any pain?
Sometimes, but pain is not my main concern. It's usually painless.
Okay. Okay. Mr. John, could you tell me, is it any attack that happened to you before 6 months?
Attack, by attack, you mean attack of blood, or what do you mean
Yes,
exactly?
same attack that happened to you now.
I couldn't remember. All what I remember is within the last 6 months.
Okay, okay. Is it increased or decreased or at the same level?
I think the blood is increasing recently, yes.
Okay, I'm so sorry, Mr. John, about that. Okay, could you tell me, do you have any history of weight loss recently, intentional weight loss?
Yes. I lost around 10 kilos in the last 3 months.
Last 3 months. Okay, okay. That's. Could you tell me, there is any general tired that you feel, loss of appetite?
I feel tired most of the time, and my desire to eat is decreasing, so my appetite is declining recently.
Okay. Is there any pain or some discomfort that you feel in back passage?
I have a long history of constipation, doctor. I'm not gonna lie, for the last 3 or 4 years, but I just used to take laxative, and that used to solve the problem. Yeah.
Yeah. I see. So, is there any swelling that area?
No swelling.
Okay. Do you have any tummy pain?
No.
Okay. Do you have any back pain, skin rash,
No, I don't have any of these. No.
any history of redness of the eye, or
No.
joint, any pain in your joint?
No.
Okay. Do you have any history of trauma in your back passage or your tummy?
No. I don't have any
Okay.
history.
Do you feel the heartbeat?
No, I don't feel my heartbeat. It's like it's
Okay.
normal.
Okay. Have you any history of vomiting recently?
No, I don't have any vomiting. No.
Any acid test that you feel?
Anyone? Sorry?
Any acid test?
No.
Okay. Do you have any history of bleeding from any orifice of your body?
No. It's just this one.
Okay. Could you tell me, have you diagnosed with any medical condition before?
Yeah, I have hypertension and diabetes, and I take medication for both.
Okay. Have any history of surgery before?
I did appendectomy when I was 16. That's what I remember.
Okay. Do you have any history of drug allergy
No.
or any medication?
No. Just the
Okay.
metformin and diabetes I'm taking. That's the only drug that I take.
Okay. What about the blood thinners?
No, I don't take blood thinners, no.
Okay. Could you, Mr. John, about most concerns about problem that you have?
The tiredness and this blood driving me crazy, doctor. I need it to stop.
Okay. Don't worry. I'm here to help you and figure out this problem that you have.
Time finished. Can you present your patient, doctor?
Okay. Mr. John, 65 years old, presented with history for bleeding rectum from 6 months, increased in recent periods. Patient has history also of decreased body weight, decreased weight, about 10 kilograms within 1 or 3 months. There's associated there's an history of associated with history of altered bowel habit with the last period of constipation. There is no history of trauma on tummy or history of local causes of bleeding, and that's it.
Okay, what's your differential diagnosis?
According to the history of this patient, 6 months period of bleeding per rectum, and decreased body weight. I'm concerned about the colorectal cancer, and also will be put if inflammatory bowel disease in my consideration. And there is a cause of local causes and bleeding tendency, and maybe ischemic colitis.
All right. And what's your most important investigation you're going to perform?
Okay, first I will go for diagnostic investigations, and go for lab imaging, and
What's your most important diagnostic investigation you're going to do?
okay, first if this patient at the OPD, I will be the flexible stomodoscopy, or but most definitive diagnostic is lower GI endoscopy for the biopsy.
Okay. And what other investigation you're going to do generally?
Okay, can be do lab investigation, full blood count for inflammatory markers, for the white blood count for inflammations, and the platelet for inflammatory, hemoglobin for detection of any complication of anemia, SR, CRP inflammatory, and liver function test, urea and electrolyte. Also, we go for stool for stool for ocular blood, and also we do go for imaging, ultrasound, abdominal X-ray for any complication, CT for staging and grading, and also we do for lower GI endoscopy.
Okay. And how will you treat this patient?
Treat the patient, colorectal cancer.
Yes, how are you going to approach the treatment of this patient?
Okay, first I will be assess the patient clinically, and will be take biopsy to diagnosis what
Fine.
type of
Fine. Okay, thank you.
Okay. Who's participating next? And we're going to tell you your station after you raise your hand.
We did 2 stations, which is infective pseudoaneurysm, rectal bleeding. Ali Abadi.
Ali Badi, yes. So Muhammad choose his station, and
So Ali Abadi, irritable bowel syndrome. Okay.
all right. Let me put the timer.
Hello?
Ali,
What's the station?
irritable bowel
Irritable
syndrome.
bowel.
Okay.
Just wait for, let me just put the timer, just 1 second. Yeah, you can start now.
Hello?
Hello, doctor.
I'm Dr. Ali Bade, one surgical doctor working here. Can I confirm your name and age, please?
My name is Anna. I am 46 years old.
Nice to meet you. Can I call you Miss Anna?
Yeah, that's very fine.
Okay, Miss Anna. Today I'm going to ask you some questions regarding your conditions. Is that okay with you?
Yeah, okay.
How can I help you today, Miss Anna?
Oh, doctor, I'm really feel very bad belly pain.
Oh, I'm really sorry. This must be frustrating for you. Would you
Yeah,
like me to
doctor.
give you some painkiller?
Okay, that will be very helpful.
Okay. Please, Anna, tell me more about this pain.
Oh, doctor, a long time ago, around 9 months, I feel this pain and started gradually, and it's getting worse day by day, doctor.
I see, I see, I see. Would you please point to the side of the pain in your tummy?
It's whole of my stomach, doctor.
Oh, I see, I see. And did it move anywhere else in your body?
No,
Anything make it better?
nothing, doctor. But I
Okay.
noticed that stress make this pain
Yeah.
very hard.
Mm-hmm.
When I was stressed, I
Okay.
feel the pain all over my stomach.
Okay. And any change in the pain during time of the day, in specific time,
No,
during morning or evening?
no.
Okay. Would you please rate this pain for me in a scale from 1 to 10? 10 is the highest worst pain.
It's about 7 to 8.
Oh, yeah, I see that. It sounds that you are really suffering from this, Miss Anna.
Yeah, doctor, it's really bothering me.
Okay. And have you noticed any unintentional weight loss recently?
No, I didn't notice any unintentional weight loss.
Any change in your appetite?
Appetite? No, doctor, but eating a food
Mm-hmm.
feel me like same as stress. I feel pain after eating.
Yeah, I see. And any fever?
No, I didn't notice any fever.
Okay. Do you have often feeling bloated?
Yeah, sometimes I feel bloated.
Okay. And when you're passing stool, do you feel this pain get relieved?
Yes, doctor.
Okay. And do you have any joint pains?
No, I didn't experience joint pain.
Any pain for red eyes?
No, doctor. Why this couple question,
Any?
doctor?
Yeah, I'm really sorry. I would like to figure out what that you have exactly. Okay.
Okay.
Do you have any trauma to your tummy?
No.
Okay. Do you have any past a similar condition like this before?
As I mentioned 9 months ago, I feel the same pain.
Yeah. Okay. And do you feel any acid test sensation in back of your mouth?
As a test, no,
Yeah.
doctor.
Okay. Any past medical conditions?
No.
Any surgeries?
Surgery, I had a
Yeah.
appendectomy
Yeah.
5 years ago.
Okay. Do you take any regular medication?
No, doctor.
Any allergy from another medication?
No, I have no allergies.
Anyone in your family with the same conditions?
No one I am aware of, doctor.
Okay, Emma, may I ask you some personal question, please?
Okay.
What do you for a living?
I'm a carpenter.
Okay, that's good. And with whom you are live?
I live with my husband and my 2 daughters.
Mm-hmm. Do you smoke?
Yes.
How many cigarettes per day and for how long?
2 bags a day and for 10 years.
Okay. Do you drink alcohols?
No, doctor.
Okay. Before I go further, what do you think might be the cause?
I'm not sure, doctor, but I'm really concerned about stone.
Okay. Okay, this is early to say this. We need just to complete our history and doing some lab checks. And in this lab checks, I will
Please
stop.
help me, doctor. Yeah.
Okay, of course. Do you have any headache?
No,
Any chest pains?
no, doctor.
Any problem in your pee or poo?
No.
Okay. Have you ever investigated about this condition?
No. I neglected it the first time.
Yeah, okay.
So, doctor, could you please help me?
Yeah, okay. Thank you, Miss Emma. I will discuss this with my seniors. I will come back to you later, okay?
Okay, doctor. Thank you so much.
Okay, thank you.
You still have like 50 seconds. Do you want to do anything?
Yeah, okay. Anything else you want to tell me I missed, Mrs. Emma?
No, doctor. Thank you helped me very much by asking these questions.
Okay.
Yeah, time finished.
Okay, thank you very much, Miss Emma, for the collaboration you put in. Thank you very much.
Thank you, doctor.
Okay.
Now, Ali, please unmute
Yes.
yourself.
Okay. I just wanna put the timer for 3 minutes. Just 1 second. All right. Can you present your patient, doctor?
Okay, I took history from Miss Emma, presented today with abdominal pains, diffuse abdominal pains. It is exaggerated with history of stress and some type of food. And there is no weight loss. And she has a past history of appendectomy, and it's not allergic to any drug medications. She smokes. My main diagnosis is irritable bowel syndromes. My differential diagnosis, inflammatory bowel disease, acute cholecystitis, peptic ulcer disease.
And you have another differential?
Yes. Gastroenteritis.
Yeah.
Yeah.
And why she was referred from the GP from the start to begin with?
Please again.
Why was she referred from the GP from the start in the scenario?
Yeah, I didn't read the scenario.
Okay, fine. I think biliary colic is one of your differential. How will you investigate your patient?
General investigations, after completing my history, doing full clinical examinations, complete blood count, ESR, CRB, doing urine generals, RFD, urine electrolytes, and the stool analysis for fecal calprotectin and fecal occult blood, abdominal ultrasounds.
Okay. What else?
And I would like to do the colonoscope to exclude inflammatory bowel disease.
Okay. And do you have any other investigation?
No.
Stool analysis, is it one of your investigations?
Yes, it's stool analysis.
Yeah. And how will you treat the patient?
Yes, first to refer this patient to social workers, lifestyle modifications to increase fiber diets, give patient antispasmodics, antidepressant.
All right. You still have 19 minutes. We finished the session. It's not a very long session. Good job, Ali. I think you asked about most of the differential. The way you presented yourself. Hello, my name is Dr. Ali. I'm one of the surgical doctors. That's what we emphasize here. You shouldn't say I've been asked to ask you. That's nobody says that in real life. The scenario, time is finished just now. So you still have like 15, 16 seconds. It's a very easy and simple scenario, and the questions are straightforward. I'm just checking if you forgot any of the differential diagnoses. Muhammad, did he mentioned the gastroenteritis?
Yeah, he mentioned all possible differential diagnosis.
But I don't think he mentioned the biliary colic. Like, does the pain move to the right shoulder? Have you noticed any pain increase with fatty meals and any other discoloration of the eye? Did he ask these questions?
No, I missed it.
Yeah, so biliary colic, because the scenario is the lady came from the GP after acute with the gallbladder stones, and then he was thinking she has IB. He was thinking acute cholecystitis, and it's just IBS. Just quick notes. You offered your patient painkiller at the start. Nice job. That will give a very good impression for your examiner. You asked an open question. Tell me more about the pain, which was a very good step to do. But you didn't mention your patient name multiple times through the scenario. Even if I ask you now, what's your patient name?
Yeah, name Emma.
Anna. It was Anna, right?
Oh, I think it. Emma.
Yes, yeah. Oh, fine. The important point is you should mention your patient name multiple times through the scenario. We, as international medical graduate, when we take our exam, and a lot of people ask me this question who take their exam in UK, and they fail for whatever reason, they will fail for such a stupid reason like this one. You shouldn't ignore your patient name while you're taking a history. You should mention it multiple times. Okay, Anna, tell me, Anna, how are you, Anna? Like you should mention it throughout the scenario, not just ask question and answers. Okay, that's a very important point. These are my points. I will leave it to Muhammad.
Okay, Ali, excellent
Yeah.
performance, but I just wanted to, I am glad that you mentioned I will do full clinical examination when Ali asks you about the investigation, but you should consider MDT. I know MDT is not mandatory for every station, but to keep it in your mind and during the stress of the exam, you should practice to say it in every station. I will discuss this case in MDT meeting. Okay? Ali,
Especially the difficult, unclear,
Yes, okay.
especially the difficult, unclear diagnoses, like diagnosis came from a GB or a diagnosis of cancer or a colon cancer or like the real hard diagnosis we always discuss in the MDT. So, and even if the simple stuff like when you are a registrar here and you're doing your own call, you will discuss every single referral in the MDT. Every single consultant will be there, either in person or virtually through Zoom or Microsoft Team, and we will discuss every single patient that referred overnight. So say I will discuss it in the MDT. There's nothing for you to lose saying that.
okay.
Okay.
Ali,
Yeah.
also, guys, I would like to add a point to make a presentation very easy for you. When the examiner asks you, could you please present your case? Just start by the patient name and age. And if you forget the name and age, just say, I took clinical history from this gentleman. Then mention the main compliant and 2 points or 3 about the analysis of the main compliant and the positive points for your first differential diagnosis. And finish it by, so my main differential diagnosis is, don't let the examiner ask you what is your main differential diagnosis and then ask you what is your other differential diagnosis, because you have just 3 minutes. So say, so my main differential diagnosis is blah, blah, blah. Okay?
Okay.
I'm glad you mentioned that. I'm glad you mentioned that, Muhammad. Also for Abdul, the previous presentation, he said according to this patient, my differential. You don't need to say that. When the examiner says, "What's your differential?" you immediately say your differential. You don't need, because the patient has rectal bleeding and because the patient had 6 months bleeding. Then no. You don't need to justify your differential. Just mention your differential. Okay, should we move to the next, Muhammad?
Yes. So we need someone to participate for the next station.
I think there were 3 people raising their hands earlier.
Who's?
I'm just checking now. Who want to participate for the next? We just have the last 2, right?
Yes.
Last 2, yeah. So 1 here and 1 in the next meeting. If nobody raised his hand, then we go with Amani if she's here. Amani Musa.
Yeah, sorry, doctor. I already chat that if I can take the last station.
Okay. I didn't see your chat, that's why. So Wala Abdullah gonna do the next station, which is Muhammad.
Counseling for OGD.
Yes. Should we just do the last station before that?
Yeah.
We'll do the acute pancreatitis.
Acute pancreatitis, okay.
Yeah.
Who? Who will
Ala.
participate? Wala.
Ala Abdullah, yes.
Wala Abdullah.
Wala.
Okay, Ali, you will be the patient. Okay.
Yes, I will be the patient. Let me just I put the time on Muhammad.
Okay, let me put 6 minutes.
And then follow up with her presentation and all the differentials.
Yeah. Okay.
Okay. Tell me when you're ready and the time is ready.
Okay.
Okay, I'm ready.
6 minutes start.
Okay. So, hello, I'm Dr. Ola Abdullah, one of the surgical doctors working here. Could I your name and date of birth, please?
Hi, doctor. My name is John Smith. I'm 50 years old.
Okay, it's a pleasure to meet you, Mr. John. Is that okay to call you Mr. John?
Yeah, that's fine.
Okay, pleasure to meet you again. So could you tell me how can I help you today?
I have this severe pain, doctor, in the center of my chest or belly. And it's very severe pain that I cannot live with.
Okay, I'm really sorry, Mr. John, for your pain. Do you need any painkiller right now?
Yes, please. I would like a lot of painkiller. This pain is unbearable.
Okay, I'm going to request your painkiller. Could you continue our conversation, Mr.
Yes,
John, now?
we can continue. Yeah.
Okay. So, did this pain, Mr. John, arising or appear suddenly or gradually?
Sudden, doctor.
Sudden, doctor. So, you say that it's in the center of your abdomen. Could you tell me what is the character of this pain exactly?
Very sharp pain. Very sharp pain.
Okay.
Like a
So,
stabbing pain. Stabbing pain, and it does radiate to my back.
So, excuse me, I could not hear this. Does it radiate to any other side?
Yeah, it does radiate to my back, yes.
Okay, it radiates to your back. So, do you notice anything that makes this pain more worse?
Yes, when I lean backward or when I eat, when I had my lunch earlier, the pain just became worse and worse, progressive.
Okay, I see. So, could you tell me if this pain radiated to any other side?
Yeah, doctor, as I told you just
rather
now.
than the back?
No,
Rather
just
than
the
the
back.
back.
Just the back.
Okay. So, could I confirm that this pain does not radiate to your left shoulder or your right shoulder?
No, just my back.
Okay. Mr. John, could you tell me, does this pain associated with any shortness of breath?
No.
Okay. Mr. Jack, do you have vomit recently?
No, I didn't vomit.
Okay. Could you tell me, do you injure your tummy?
No.
Okay. Mr. Jack, could you please scale this pain for me from 1 to 10? 1 is the lowest and 10 is the highest.
9. I will say 9 out of 10.
Okay, I'm really sorry for that, Mr. John. Mr. John, actually, I need to ask you a few questions, some personal question, okay? Mr. John, do you drink alcohol?
Yes, I do.
Okay. Could I know how much you drink per day?
1 or 2 bottles.
Okay, 1 or 2 bottles. So, do you smoke cigarettes?
Yes.
Okay. Mr. Jack, do you experience similar pain before?
No, that's the first time I experienced such a pain, yeah.
Okay, I see. Do you have any medical condition, Mr. John? Do you visit your GP for any medical condition?
Diabetes and hypertension, which I take medication for.
Yeah. For how now since when you had
Yeah, diabetes 10 years ago and hypertension 15 years ago.
Okay. You are in a regular follow-up?
Yes, I am.
Okay. So, do you have any do you take any medication in a regular manner, Mr. John?
Yeah, I take the medication and the diabetes Medication for diabetes and
Rather,
hypertension.
okay. Yeah.
Nothing
Rather
else.
than this?
No,
Okay.
nothing.
So, do you have any allergies to any medication that I should know?
No, I'm not allergic to nothing.
Okay. So, do you underwent any surgeries before?
I didn't underwent any surgery, no.
Any hospital admission before?
No.
Okay. That's good. So, Mr. John, could you tell me what is your job?
I'm not employed now.
Okay, I understand. So, with whom do you live?
I live alone.
Okay. So, Mr. John, I understand from this conversation that you have this severe sudden
Time
central
up.
tummy pain that.
Time up.
Okay. Time finished.
Could you please present your case?
Okay. I met today Mr. John. I met today Mr. John, who is diabetic, no case of diabetes, hypertensive, not on any anticoagulants or any drugs rather than for diabetes and hypertension. Presented with sudden severe abdominal pain that worse when he leaning backward. The patient is taking alcohol and smoke cigarette. Based on this data obtained from the history, my main diagnosis will be an alcoholic pancreatitis, but I will also consider it an myocardial infarction as serious and should be excluded. Also, this may be an gastroenteritis or perforated peptic ulcer. Also, it may be an calculous cholecystitis or biliary colic.
Okay. You said this is alcoholic pancreatitis, right? Is it acute or chronic? Your first differential.
Yeah, it's an acute.
Okay.
This
Could you
is the
please
first time
define what is
patient
acute
experience.
pancreatitis?
Okay, acute pancreatitis, it's an inflammation of the it's an inflammation of the it's an acute inflammation of the pancreas in which the patient presented with
Okay, maybe caused by alcohol or gallstone. Okay. How to approach this patient?
Okay, I just taken a history from this patient, so I think I'm going to do a full clinical examination for this patient, especially an abdominal examination. Then I'm going to investigate the patient. I will start by a bedside investigation. I'm going to arrange an ECG to exclude the myocardial infarction. I'm going to request an arterial blood gases. And also electrolytes. I'm going to request a full blood count, urea and electrolytes, inflammatory markers, and also I'm going to request, and the patient is in acute presentation or recent presentation, I'm going to request an amylase, and I'm going to request also lipase as it's more specific. And
why you said lipase is specific? Why lipase is most specific and amylase less?
Okay, actually, the patients have an acute presentation or acute abdomen, so I think there is many causes. This situation may cause an rising of amylase. So I will go with lipase.
Do you have any other reason?
Okay, yeah. In case of amylase has a short life of presentation. It just presents as early. It's
Time up. But continue your answer.
Okay. So amylase have a short half-life.
Yeah.
It also appear after 48 of inflammation and appear after
Yeah, and it's secreted from different parts of
48.
our body.
And yeah, it's not a specific
Okay.
pancreas.
Okay. And how you will treat this patient? The last question.
Okay, so the patient with, as my diagnosis is pancreatitis, the patient should be assessed, the severity of pancreatitis should be assessed, and depending on that, I think this patient needs an ICU admission. The management mainly will be on a supportive management. the management will be mainly supportive.
Okay. Okay. Do you like to add anything for the management?
Yeah, I guess I have a mental block right now, so I
Okay,
don't
no problem.
remember.
Yes, supportive care like IV fluid, analgesia, and antiemetic.
Yeah,
And patient must be nail by mouse.
yeah.
Also, you should advise the patient about alcohol. Okay. So, Ali, do you like to start?
Yes, good presentation. Well, you have just small points that you just need to work on, but you tackled most of the differential in a good way, and you mentioned all the differential diagnosis correctly. You just said multiple grammatically incorrect sentences like "Do you have vomit?" You just asked, "Did you vomit?" and that's it. It's not "Do you have vomit?" You started your Socrates, but you didn't finish it. You started your differential diagnosis. You came back to the pain scale.
Yeah, there's disorganization.
Yes, so you started the differential and then you remembered, oh, I didn't ask about the severity. Let's go back and ask about the scale of the pain from 0 to 10. So make sure you finish Socrates before you start your differential diagnosis. You didn't ask about non-steroidal anti-inflammatory drugs. You asked about any other medication you're taking, but it's better to be specific. Do you take any of the ibuprofen or non-steroidal anti-inflammatory drug because one of your differential is peptic ulcer, perforated peptic ulcer.
Yeah.
Okay.
Do you write while you're taking your history?
Yeah. Actually, I try not to write, but I just
When is
in
your
my
exam?
practice I always write.
When is your exam?
In 25 of April.
Your exam is not that far. Okay, so look, even if you are writing, try to not write while you're practicing with us, because this will make you better when you write. Does that make sense? So train yourself not to write. I know some people says, like a lot of people say, you write, that's okay. Yeah, it's okay. It's not forbidden from the exam, but your image will be bad for your examiner, and your image overall will be like unprofessional. And as I said, this exam is how you present yourself. It's not a knowledge exam. Imagine yourself holding a paper. Hello, how are you? Hi, what's your name? My name is John. How old are you, John? 43. How can I help you? Do you think that's a better idea, or someone who's just talking to the patient casually?
No,
Which one is better?
No.
So present
it's
your
better to communicate.
yes, present yourself for the examiner in a good way. And I think by writing, you damage your image. And the examiner has around 10 marks of just the overall impression of how you present yourself. So please avoid writing. You have 1 month or 1 month and a half practice without a paper. Don't listen to those who say, yeah, you can write. Yeah, you can write. It's not forbidden in your exam, but your image will be very bad. You said, just ask the question right. Are you in a regular follow-up, or are you following? Don't say you are following. You are, that's a sentence. If you want to ask the question, it's are you, not you are. Do you underwent any surgery? That's did you like any previous surgery? You can just ask simple like that instead of do you went any surgery. When you present it, that's very important. When you're presenting your patient, you started by the important negative. That's incorrect order. You should start by the important positive first, and then the important negative for your patient. You said, Mr. John, you didn't mention his age because probably you forgot, which is fine.
Yeah.
And then you started to mention the important negative. You should, Mr. John, 45-year-old, presented with central abdominal pain, 9 out of 10, radiating to his back, he's alcoholic, he's drinking alcohol, and then you say the negative stuff. You mentioned the cigarette, which is fine. That's all. That's most of my point. Overall, your
Najwa, please mute yourself. Ali Badi, please. So, Wala, are you here?
yeah. Let's wait for Wara.
Yes, I'm here.
Okay. Yeah, Mohammed, continue.
Yeah, I think you mentioned all point, Ali. Thank you, Wala, for participating, and you did very nice job. I would like to mention that you didn't start by asking an open question. You start immediately by Socrates. You should ask, Ali, could you please tell me more about this? And I am so glad that you mentioned painkiller and you first exclude myocardial infarction. Just this organization, I think I remember you asked about vomit, then you asked the patient about did you injure yourself? So just a little organization and you will get so perfect.
Fine. Should we finish? Mohammed, I don't think you published it in the big group. You just published it in Medicoplasty.
Yeah, I publish it in the
Okay.
and
So
MRCS
from tomorrow, we're just gonna. I don't want to buzz up the big group. To be honest, we're gonna advertise in our group. So I sent the link earlier. Just join now. We will not advertise in the big group. We don't want to create a big headache or multiple unnecessary messages. So for this next 6 days, join our group that I published in the chat, and I'm going to do it again. Okay, Muhammad, last station, which is communication.
سوري دكتور بس سوري دكتور يعني ما كل الناس في ميديكوبلاستي وانا رسلت لك قبل كده برايفت تقريبا كم مره عشان تدخلني الجروب للان ما دخلتني.
Amani.
اماني ايوه.
Okay, I sent it the group again in the chat. I'm not sure if you can see it. Like, if you cannot see it, I'm going to send it again now. And
طيب.
you are more than welcome to join.
Okay.
Let me just re-copy it again. Okay, Muhammad, proceed to the next station.
Yeah, Ali, please let me repeat the point about the presentation because Wala start by negative important and forget to say the positive important.
Yes.
So as I mentioned, just start by the patient name and age, then go to the main compliant, then some points of main compliant analysis. And the last thing, give the positive important about your first differential diagnosis. And immediately, so my main differential diagnosis is, okay? So the last session about communication skills in person. Ali, I think you should mute yourself, yes, okay? So who will participate for this station? OGD, counseling for OGD. Who will participate for this station?
If nobody raises his hand, just Amani can do it. Somebody raise his hand.
You need to practice.
May I do it, the Sabi here? Because Amani participated earlier, so I'll give it to Sabi.
Okay. So Sabi, are you ready?
Give her, I think it's a long scenario.
Yes.
You're not recording, Muhammad.
Okay. Yeah, no, I am recording. So Ali, I will put 9 minutes. You know why I don't put the 10 minutes? Because there are minutes for the examiner will ask you about your candidate number and the grading. You'll take about the 30 seconds to 1 minute.
Okay, I'm gonna tell you the scenario, تسابيح, and then we're gonna start. You have 9 minutes. Muhammad, put the timer and follow up with her. I'm gonna be the patient.
Okay.
You are asked with counseling a patient who has dysphagia and is scheduled for an esophageal gastroduodenoscopy OGD procedure. The patient is holding tissue due to excessive salivation. Your role is to explain the procedure, address the patient concern, discuss potential risk, and obtain consent for the patient. All right?
Okay,
Your patient name is Ses.
What?
Ses.
Ses, okay.
You have 9 minutes now.
Start.
Hello, I'm Dr. Tasabih, one of the surgical doctor. I'm glad to meet you, Ses. Today, I would like to explain to you procedures that we would like to arrange for you. And just to make sure that we are in the same page, I just want you to tell me more regarding your condition and what do you know so far regarding the procedure that you are planning for.
To be honest, doctor, I know nothing. I just received the letter and I have a procedure that I know nothing about. And
okay.
Nobody is free to explain anything in this NHS.
Okay, so no worries. I will explain to you anything, okay? Actually, are here today because we are planning to do some procedures called esophageal gastroduodenoscopy. It is kind of medical procedure in which we will insert a tube, and this tube will contain camera. We will insert it first through your mouth, then after we will go down to your food pipe, and after that we will go to your stomach, and finally we will reach the first part of your small bowel. During this, the camera will relay image in the screen, and this will help us to find out what is the cause behind your complaints. I'm clear so far regarding this until now.
Yeah, you are clear. But I think you didn't answer my most huge concern. Like, will I be awake of this procedure while you're doing this?
Okay. Regarding this point in this procedure, you will not be fully conscious. Okay, you will we will give you some kind of numbing agent, and this is will help us to introduce this tube smoothly. But this will not be painful for you, and you will not be fully aware about the surrounding. But I can arrange with anesthesia specialists to discuss more regarding this and to discuss with you more regarding this point.
Yeah, but before you arrange me with anesthesia, will I be awake or will I be asleep?
No, in usual situation, you will not be sedated fully. Okay, you will be awake.
Okay. Will I feel the pain?
No.
Okay, so it's going to be half. Fine. What are the risks of this procedure, doctor?
Okay, to be honest, regarding this procedure, we have many risks. For example, while inserting the tube through your mouth, there is a risk of damaging some of your teeth, and also while taking samples, there is risk of bleeding. And after the procedure, you may develop some sort of infection like chest infection or other type of pneumonia, something like that. And most important risk that might happen to you, you have risk to develop. We may do cut through your food pipe, and in such situation we have to do surgical intervention. Okay, but I just want to assure you that the procedure will be carried by an experienced staff and doctors, and they will do their best to avoid this.
All right. I'm glad to hear that. I just want to know, doctor, why I'm salivating.
I'm really sorry for that. Must be frustrating for you. Says in your such situation, it's expected to develop symptoms like this, as there is narrowing in your food pipe, and this is will slow the normal flow of the saliva. So this procedure will help us a lot to avoid this, as we will make widening for your food pipe, and this is will be avoided in the future after this procedure.
Yeah, but you didn't answer my question specifically. Why am I salivating?
Okay, you have some sort of narrowing in your food pipe, and this is just it slows the downing of the saliva. That is why you are salivating a lot.
Okay. Do you think it's a cancer, doctor?
Okay, I really understand your worries, but it's too early to discuss such a situation. First of all, you have to undergo this procedure, and after that, we will have a clear picture regarding your condition.
So you don't know if it's a cancer or no?
Until now, we don't have, yes, I don't know until now.
Okay, and after this procedure, when you will get the answer?
Okay, regarding this, it will be ideally within 2 weeks. If it's
2 weeks.
come before that, I will contact you.
Okay, and do I have to stay in the hospital?
Usually there is no need to stay in hospital. Okay, you will be discharged after 2 to 4 hours after the procedure. But in some situation, you may need to stay in the hospital if any complication might develop within your procedure.
Okay, fine. I think you explained most of my questions.
Okay, so do you have any concern or something that you want me to explain it for you?
I think I'm satisfied with most of your answer.
Okay, so this is, to do this, ideally you have to make consent, just to make sure that we are in the same page. I just want you to tell me what we have been through.
You told me you're going to insert a specific device through my mouth to my stomach, and it has a very weird name, procedure, and then I will be half awake, half asleep. And there's multiple risks for this procedure, but we need to do it. Yeah, so I'm okay with that.
Okay, so the situation, if you don't mind, I just want you to consent or to sign for this consent after you read it.
Where is your consent?
Okay. I will ask this nurse to prepare it, okay?
Okay, fine. I'm happy to consent.
Okay, thank you for your time.
You
All right.
have 2 minutes.
How many minutes do
You have 2 minutes. You would like to add anything?
Okay. There's a consent. If you want to discuss anything or to ask me regarding anything, I will be glad to answer.
Okay, fine. I think that could be enough, Muhammad.
Okay.
Very good. That's a very good presentation. Yeah, I will come to the general advice. So you started by introducing yourself. You asked the patient why he's here. I think you just need to practice more how you explain the OGD. This called esophagogastroduodenoscopy. Flexible tube will be inserted through your mouth down your food pipe. You said all of this, but you just need to say it faster in a very coherent way, so your examiner will give you more mark. So you have to memorize this one. Into your stomach and along the first part of your small bowel, you said all of this. The image capture by the camera. Did you mention the camera?
Yes.
Will be displayed on a TV screen, so we can examine the inside of your digestive tract. As I think you performed very well, especially in the layman language. You didn't mention any medical jargon. The image captured by the camera will be displayed on the TV screen, so we can examine the inside of your digestive tract. Additionally, we will widen any narrow area in your food pipe. We didn't say any structured area or restriction. We just say narrow area. During the barium swallow, and we may also take tissue samples for further analysis. We didn't say biopsy. You mentioned your patient name, but you needed to add in more, like mentioning like
You
twice.
didn't mention the patient name Ali regularly.
Yeah, she didn't mention it regularly. That's what I'm saying. So in the history and here, mention your patient name multiple times. When he asks you is there any risk, the good that you did, you mentioned the point of this will be done by experienced surgeon. The one that you forgot to mention, you should assure the patient saying any procedure has risks involved. This and then like any procedure has risk, you should tell him that, and then you say, as you said, this will be done by experienced doctor. That's a good part. At the end, I didn't ask you for the consent. I was thinking that you may forget to ask for the consent, and you will be surprised. Some candidate will do all the station right, and they forget at the end to consent the patient. You will fail because the most important point for this station is to consent the patient. You did all this discussion to make sure the patient signs the paper. And during the stress of the exam and the high pressure during the exam, you may forget at the end to consent the patient. So don't forget to consent the patient. But otherwise, I think that's a pass. That's a very good presentation. Muhammad?
Okay, Tasabih, I just wanted to mention about the professionalism, Tasabih. In the exam, you will find the file, the patient name already written. So you, in the every station, history or communication or examination, you need to confirm the patient name. So either by say, may I confirm your name and age, or by saying, hello, Mr. Jack, today you are coming to discuss, and so on, okay? Also, when Ali asks you what is the risk of this procedure, you mention all the risks, and you rest assure the patient at the same time. So I think you need to be silent for a moment. Allow Ali to say to you that I don't need the procedure to get the mark of the answer by reassuring him. Okay.
Okay.
Also, you need to change your tone.
I think Muhammad, this is my mistake. I should have challenged her more and say I don't want this procedure, and then I see how she reacts. But I just agreed to what she said. That's why I didn't give her the opportunity by saying I don't want this procedure.
Explain to you the risks and assure you at the same time.
Yeah, I should have said I don't want the procedure. I didn't say that.
Yeah, she should silent for a moment to let you say this, Ali.
Yes.
The last point, at the patient name, you need to mention the patient name regularly.
Okay.
Okay. Also, the consent, explain to the patient that the consent contains that you are agree of the procedure and the benefit and the risks. Then ask him to consent.
Especially you had the time at the end. You had like 2 minutes, so you can just take this 2 minutes saying, okay, Mr. John, this is a consent, you will have this procedure. You just repeat yourself again. Okay, good job, everyone. Muhammad, before we conclude, I will just add 2 or 3 points. Tomorrow, we're not going to advertise in the big group, so make sure you are in the Medicoplasty group. Tomorrow is going to be the same time, 5, because I'm doing night shift. We're going to finish exactly the same way. We encourage everyone to practice. Those who practice today, you will benefit more by practicing tomorrow when you join us. And that's it.
Ali?
Yes, Mohammed.
Also, I will go through the tips about the history station for those who came up later. So, in the history station, after reading the scenario and entering the exam room, grade the examiner, and then grade the stimulator. Then present yourself and start by after knowing the main complaint by feeling sorry about the patient complaint. Then analyze the main complaint by starting an open question. Don't start by when did you experience this pain, where, what are the character. Start, could you please tell me more about this pain? And apply Socrates for any history station to make it easier to remember. In the abdominal pain, rectal bleeding, lump in his groin, and don't repeat the question patient already answered it.
Yeah.
Because you have just 6 minutes to ask all questions. So you need to listen to your patient carefully And by keeping practicing, you will master all these points. Regarding the social history, there are 5 questions in this section, which asking a patient about where you are living, what do you do for living, and who lives with you, and the stare and smoking and drinking. If you have time, ask it all. If you have not, you should ask what relevant to the scenario. And in the patient with colonic cancer, you should ask first about the smoking and alcohol consumption, okay? And if you miss a question, back to it easily. Regarding the differential diagnosis, always start by your first differential diagnosis. Then the second most serious as cancer. In the scenario of acute pancreatitis, here myocardial infarction come first because it's an emergency. Okay? In case you forget what to ask about, remember these 4 essential differential diagnoses, which is these 3 differential diagnoses, ICT. I abbreviated as ICT: infection, cancer, and trauma. If the pressure of the exam is so hard, then don't miss to ask about the infection, cancer, and trauma, okay? ICT. And the last thing about the presentation, as I mentioned it a couple of times, start by mentioning the patient name and age, then main compliant, then analysis of the main compliant 2 to 3 points, then the positive finding of your first differential diagnosis. After that, immediately say, so my main differential diagnosis is, don't let the examiner ask you what is your main differential diagnosis, and then ask you what is your differential diagnosis, because you just have 3 minutes, okay? Hope all of you passing the exam of MRCS Part B.
Yes, and we did a 3 sessions like this. We did multiple sessions with people previously, 20 persons, and 18 of them passed the exam. So you're gonna pass. Just keep an eye, practice. These sessions will be uploaded and recorded. And if anyone doesn't want to be recorded, he can send a message to us. But we're assuming everyone is okay with the record. Everyone can review himself. We're going to upload the videos on the WhatsApp group, and you can review yourself and see what did you do right and what did you do wrong. And I advise everyone to record himself while practicing. Put the camera in front of you. If you are practicing with your friend or a colleague, put the camera in front of you. That's what I used to do. And practice in front of the camera at the end review and see what did you do wrong. Did you scratch your head? Did you did an unprofessional move? Did you touch your nose? Did you touch your hair? So record yourself with a video. Good luck, everyone. We're going to see you tomorrow at the same time. Make sure you are in the Medicoplasty group, as we are not going to advertise in the big group again. Okay, bye, everyone.